Welcome to Perimenopause Hell. This video is about the use of HRT and the combined pill in early perimenopause. The major concern about using HRT in early perimenopause is that your own body is still making some hormones. It may not be making hormones steadily, which means that sometimes you're going to be a bit low in estrogen and you're going to be having some symptoms. But if you start taking a whacking great dose of HRT, then you will have too much estrogen, and the major problem with this is that it will cause your uterine lining to get too thick. And when this happens, basically it means that you're going to get breakthrough bleeding. You're going to start bleeding when you shouldn't be bleeding. You might have very, very heavy periods that last a long time. And you might experience spotting all of the time, which is not really what you expected or wanted. And basically that is a result of your body still making some estrogen and you're taking estrogen from the HRT. So in general, there's far too much estrogen going on, more than you really need, and it will cause trouble and it will increase your risk of developing cancer. So basically, if you want to take HRT at this time, you're going to have to go on a sequential regimen. This means that you will have a period once a month, same as in the old days, and this will stop your uterine lining growing too thick, hopefully. If you're taking a great big dose of estrogen, then even though you have your period once a month, you might be on so much that you still have breakthrough bleeding anyway. But hopefully your doctor is clever and they put you on a reasonable dose that won't cause too much problems. And if you do get problems, you can adjust it and reduce the amount of estrogen. So there are ways around all of these problems. So anyway, sequential HRT gets that name because you take it in a sequence that mimics that of a normal menstrual cycle, with the period at the end of the 28 days. So this means that progesterone must be a part of the treatment. And it must be because it's the progesterone that determines when you will get your period. So when you're taking progesterone, it isn't until you stop taking it that you have a bleed. And this isn't really a period. It's what's called a withdrawal bleed. And that happens in response to you stopping taking the progesterone. So progesterone also protects your uterus from cancer. And this is why all types of HRT, combined pill, and that kind of thing always contain a progesterone. So if you still have a uterus, you will have to take progesterone if you're going to take any sort of estrogen. The only time you don't have to take it is when you're using a very low dose kind of estrogen cream or something like that for preventing atrophy. So with the sequential HRT, it is the estrogen that helps with most of your symptoms. Progesterone doesn't really do an awful lot to help with perimenopause symptoms. It's only there so that you can schedule your periods, and that's useful if you've been having irregular periods or experiencing spotting. So most likely you're only going to need a little bit of estrogen at this point, because you're still only in early to mid peri. Most women in early peri tend to get symptoms that cluster around their ovulation and periods, which is when their estrogen is lowest. And it could be the case that you only use the estrogen then when you need it, because actually using the smallest amount of estrogen you can to relieve your symptoms is the safest way to use it. An alternative to using HRT is to use a combined birth control pill. This is a combination of the two sex hormones, progesterone and estrogen. Some doctors are happier to prescribe this than HRT to younger women. But all the same, you're not using it for contraception, you are effectively using it as hormone replacement therapy because of the estrogen that's in it. Most birth controls contain synthetic hormones. So the estrogen is usually a type called ethinyl estradiol, And the progesterone is usually norethistérone or some other type like medroxyprogesterone acetate. These days there are two sorts of combined birth control pill. There are the older types. An example of this is Marvelon, and that contains 30 micrograms of estrogen. And we have the newer types that have been developed, like Loloestrin, that has only 10 micrograms of estrogen. So something like that is perfect for women who are in the very early stages of perimenopause, because you only need a small amount of estrogen. Some women who have been on combined birth control for a long time find that their doctors actually want to take them off it as they approach menopause, as you get towards your 50th birthday. This is because HRT of the older type, like Marvelon, for example, has an increased risk of breast cancer in older women. So this is much the same as hormone replacement therapy. There is that risk. There's an increase in cases of breast cancer for women using these products. It's not a massive risk. Basically, if we talk about the risk, in every 10,000 women who aren't using any hormones, there are about 30 cases of breast cancer. For women who are taking HRT or the combined birth control, then there's an extra 8 cases. So you have to make up your mind if you're happy to take that risk, and your doctor will thrash it out with you and you'll decide together, hopefully. Anyway, so these newer types of combined birth control contain less estrogen and they have a lower cancer risk, so doctors are usually quite happy to prescribe those. Even so, they still contain estrogen, and the doctor will discuss with you if the risks outweigh the benefits in your individual case. And it's also worth saying that some doctors these days just don't want to prescribe anything that contains estrogen to anybody ever. And sometimes this is because doctors are worried about being sued. And some doctors just don't think that women should take any hormones at all. I mean, there's all sorts of different types of doctors. They all have their own opinions. Don't expect them to be cookie cutter type of people. They all have their own academic opinions on things. Some women can't take birth control because of things like migraine with aura that's supposed to be made worse by estrogen, previous blood clots, and other medical problems. All the same, you shouldn't assume that birth control is out of the question for you. For example, if you have high blood pressure, so long as you're actually taking a medicine that is working and controlling your blood pressure, then a doctor might consider that it would be okay to try you on combined birth control. And you can keep a watchful eye on how you feel and take your blood pressure regularly. You might be okay, or you might decide that you need to stop taking it. Some women react really badly to progesterone, and this is because it's the hormone of PMS and pregnancy. So if you think about how you are premenstrually, progesterone can really magnify those symptoms. It can cause a very low mood, depression, irritability, all of those kind of mood problems that you get just before your period. And for some women, they just can't tolerate it at all. So it will be not really something that they can take. And that's the same with HRT, I'm afraid. That said, many women are absolutely fine. They can use all sorts of types of progesterone, including Mirena, and in that case, it's an ideal stopgap until they're ready to move on to HRT. I personally know absolutely loads of women who have taken this and have found it completely ideal. One of the things that is a bit of a vexed issue with combined birth control is the question, do I have to have a period? Most combined pills have a 7-day placebo pill, or sugar pill as some people call it, that doesn't actually contain any hormones. This is when there's no progesterone going on anymore in those pills, so that means that you'll have a withdrawal bleed or a period. Some doctors allow patients to skip these 7 pills and they just go on to the next 21 pills of the next packet. in this case, you'll skip the periods. So some women like that. It's very convenient, but there are potential problems with that. As I've already mentioned, the major difficulty in taking hormones at this time is that your uterine lining can get too thick. And having a period every now and again means that you shed that uterine lining. And, this makes your uterine lining nice and thin and healthy. So it's really not a good idea to skip too many periods and run that risk, because that is the thing that causes the risk of uterine cancer to escalate. Also, since there are no hormones that week, the problem with having a period is that your symptoms are likely to return. You can, however, do something that week, like try some phytoestrogen supplements, soy isoflavone, maca, something like that. You shouldn't take that at the same time as you are taking the actual hormones, but it's okay for that week that you have your period. So, on to using HRT. If you still have regular periods and you go on to HRT, you're going to need a sequential HRT where you still have a period for the reasons I've already gone into. And you'll need an HRT that is reasonably low in estrogen and high in progesterone. The progesterone protects your uterus from the possibility of there being a bit too much estrogen floating about at some points, and the low amount of estrogen is just enough to alleviate your symptoms without bringing an extra risk. So, too much estrogen, as we've discussed all the way throughout this, causes an overgrowth of the uterine lining, which is known as endometrial hyperplasia. And that can cause in itself breakthrough bleeding, heavy periods, all sorts of unpleasant bleeding generally. One thing that's becoming quite popular in early to mid perimenopause is using something like an estrogen cream or gel. And I'm not referring in this instance to the very low dose creams that are used for atrophy. I'm talking about a gel that you can apply to your body, not to your vagina. So what you would do in this case is you use the gel, and it is dispensed from a pump, and you would use like 1 or 2 pumps a day and combine it with some other form of progesterone. So just like all the other ways, you're getting some estrogen and you're getting some progesterone. In early to mid perimenopause, the lowest amount of this gel that you can possibly use is what you're aiming for. The types of progesterone that you would use, you could use a Mirena for this. You could take Prometrium, which is a bioidentical micronized progesterone that is usually taken as a pill. You could use Depo-Provera injections. You could take the mini pill or progesterone only pill. There's all sorts of different options. You could just take a plain brown bread Provera pills, whatever. There's lots and lots of variety there. Your doctor might tell you to only use the estrogen gel when you really have symptoms. So that might be when you have a period or ovulation. And they might tell you to use it for only a maximum number of days per cycle, or they might tell you to only use 1 pump a day, whatever it is. Stick, please, to what your doctor says. Don't overuse it. Although it seems like, it's just a harmless gel that comes in a pump, it's got hormones in it. It's a strong medical product, and you have to be very careful with it and respect it. This is a method that requires your doctor to trust you, and it's a reason why lots of doctors just won't prescribe it. And the reason they won't prescribe it is because it's very common for women to think, oh, I really like the way this estrogen gel is making me feel. I feel absolutely great. I'm going to use loads. I had a bad day today. I'm going to use 2 pumps. And then before you know it, 2 weeks after they've got their prescription, they've used it all up and they're asking for a new lot. So ask the doctor how long the cream is supposed to last you. If it's meant to last a month, then for goodness sake, don't just start using it whenever you feel like it. That also puts you at risk because you're using more than you're supposed to. So, just to recap, if your doctor thinks you're a good candidate for full HRT, most likely it will be a sequential one where you have a period every month. If you've been skipping periods, the increase in estrogen from the HRT may mean that you're now getting a period once a month again. This is totally normal. And if you're on a sequential regime, as you should be, then that period will be built into what you're doing anyway. So you'll have it very routinely. If the HRT that you have is too strong, then you're going to notice breakthrough bleeding or spotting. This is a small amount of blood that you may notice when you've been to the toilet on your toilet paper after you wipe, or just a little stain in your underwear. So anyway, all this sort of bleeding when you're not supposed to is the commonest symptom of when the estrogen levels in your body are too high. So quite often this settles within the first 3 months, so don't give up. If it doesn't settle, you can get the doctor to reduce the quantity of estrogen. You can drop down, for example, to a lower dose of patch. And anyway, any of these problems, these niggles, can be sorted out. Don't just chuck it in the bin and think, well, it's not working. There's loads and loads and loads and loads and loads of different types of HRT, different things that you can do, different doses. So don't worry. In terms of the different types, combi patches these days are quite popular because it's very hard to kind of get the sequence of things wrong. These come in sequential or continuous. They're a combination of estrogen and progesterone. And the sequential one, which is the one that you're supposed to get if you're still having periods, means that you have a period every month. If you get given the continuous ones, there's probably a mistake. Although in the UK, there's often a shortage of these estrogen patches, so you may be given the continuous ones as a stopgap. That's not really a massive problem, but you might notice that your period's a bit heavier the next time you get your sequential ones. Pills, of course, are another option. A lot of women in America seem to be given Prempro. I don't know if it's cheaper or something like that. The conjugated estrogens now, like Premarin products, are not really all that popular because this is what the big WHI study was based on. Conjugated estrogens are not the bioidentical type, and there are ethical concerns about the way that Premarin is manufactured because it's made with pregnant mares' urine. So if you are concerned with animal rights, that's something you're probably going to want to avoid. There's millions and millions of types of HRT. And just another example, if you already have a Mirena for controlling various symptoms or for contraception, then you could just add an estrogen patch or an estrogen gel, and Bob's your uncle, you're on HRT. So that's the end of this particular presentation. If you liked it and found it useful, then please like and subscribe, tell your friends. The link to the group is in the description box below. So if you're perimenopausal, then join us on Facebook or MeWe. Thank you very much for listening. Cheerio.